Investor Connect podcast program. This is Hall T. Martin. I'm the host of the show, in which we interview angel investors, venture capital, private equity, family offices, and many other investor groups for startups and growth companies. I hope you enjoyed this episode. Thank you for joining us. Well, hello, this is Hall Martin with Investor Connect. Today I'm here with Sajol Ghoshal and Stephanie Probasco of Advanced Telesensors. Sajol and Stephanie, thank you for joining us.
Thanks, Hall. Appreciate you taking the time to talk to us.
Great. So what was your background before joining Advanced Telesensors? What did you do before this one?
So, Hall, most recently I was part of a sensor company called Advanced Austrian Microsystems, which acquired a startup I had worked with called TAOS, Texas Advanced Optical Sensors. And in that company, we did a lot of optical sensing and multi-frequency optical sensing. It was used initially for just ambient light sensors, but we then migrated that technology into detecting of heart rate for like SpO2 and oxygenation in the body. So we learned a lot about wearables and how we use optical sensors in wearables to be able to detect heart rate and oxygenation levels within the body. So that was kind of my starting point in exploring how sensors can be used in detecting and being applied in the healthcare industry. I've sort of had the habit of building startups. I started my career way back in the 80s with a company called Level 1 Communications. And I've since then been driving startups with interest to drive value out of taking technology and intersecting very large markets. I've had overall $3 billion in total exits. And part of that learning, which has come through in course of doing these different companies, is that you have to move fast while optimizing a design to target a very critical market segment that is just waiting to be exploited. You've got to be nimble enough to make changes so that you can address those market needs very quickly.
So what led you to start work in the non-contact sensor space?
So the non-contact space became very interesting. I've always had an interest since, in the past to be able to monitor vital signs of a body without you having to make any effort. And so the market did expand and in terms of wearables where you could start to manage and track your vital signs. But there was a fair amount of inconvenience and management of the wearables. For instance, the early wearables are only a couple of hours of life and they've moved it up to 8 or 9 hours, but you still have to charge them and you have to wake up and put them on. And if you didn't put them on, then you didn't get that particular piece of data. So in course of working in that wearable, I found that if we could do non-contact sensing and track someone's heart rate and respiratory rate 24/7, we would gain a whole lot of information. And a lot of that would also help us limit or reduce some of the fears we have, especially in the aging population where we start to be concerned about the initial start of heart arrhythmias, which can lead to other cardiac events that could be quite stressful. So that fear can be eliminated or minimized by having an instrument that can track your heart rate 24/7. I had about a couple of years ago, I sort of had a personal experience with my mother-in-law who suffers from COPD. And it was about 7 in the morning when we were all woken up and she seemed to have indicated that she was having respiratory or breathing issues. But it was very hard to understand where the problem was. She did have oxygen, so it wasn't clear if the oxygen tank had failed or that there was oxygen limits or a real physiological problem. But you can see from her eyes that there was a fair amount of intensity and stress. And so we'd call 911 and sure enough turned out that she had a lung that collapsed and we had to, solve that problem. The learning from that was that you really couldn't figure out what was happening inside the person other than through the facial expression and eyes. And so I thought, wow, if I had this non-contact sensor that was tracking her throughout the night and giving her background information on what a heart rate was, and then when that particular event occurred, we saw an escalation in some of the parameters, either the heart rate, respiratory rate, or heart rate variability, that would give us early information that there was something traumatic occurring and that we should do something about it.
Well, that's very fascinating. Yeah, it's a very personal space for you then. So we have a lot of investors who listen to the show. And so we always ask, what's your advice for investors who are considering to invest in this space, the non-contact sensor space? What would you tell them?
Well, this is a very interesting space. And I think in the decade we're in, sensors has become the driving force of what's growing right now. And sensors are occurring in almost every aspect of our lives. So one of the things that to look for investments is to look for sensors that can be scaled into different markets quickly. without reinventing everything from scratch. That gives you the opportunity to target a very large market while developing a single product. The second piece to keep in mind is to look for platforms that take advantage of things that are occurring in today's standard developments, like and exploit the IoT and artificial intelligence trends. For instance, being on a platform with a standard Amazon Web Server or Microsoft Azure is something that connects everyone today and connects a whole bunch of smartphones, etc., without a major amount of effort. And this simplifies the deployment into the market. And that brings up the third element, which is that you should invest in systems that can passively collect anonymized personal information. And this information can be significantly monetized as you collect it from thousands and millions of people, especially in the healthcare area.
Well, that's good advice. So you've looked at this industry for some time. How do you see the industry evolving? What do you see happening here?
So the non-contact industry, I think, will impact a lot of parallel industries that we haven't thought of directly. We know that we can apply this technology to areas of baby monitoring and elderly care, but we seem to see an acceleration of the shift in other healthcare targets like healthcare in the home, in semi-autonomous vehicles, and in data analytics, which will drive a lot of new creative products where people can seamlessly interact and connect with. So today's health sensors, almost 99% of them are all touch-based, and they are full contact. There are hundreds of millions of cases where non-contact is needed and is demanded. And this percentage of penetration will definitely increase. As an example, we're all quite aware of wearables, but wearables have only penetrated about 5% of the elderly and baby markets. That's a huge opportunity that is waiting to be exploited.
So what's the growth rate of the vital sensor monitor sector? How fast is this growing?
That's a very interesting question, Hall. I think it sort of provides a little different view of what's happening in the market, because we seem to be looking at some of the large market growth areas that we see like Uber, etc. But this market is also growing quite rapidly. As I indicated before, the penetration is very low. In the baby monitoring area, we're seeing an expected 50% growth year on year, and it's only 5% today. In the elder care, which you've got very little penetration, it's almost a 300% growth that we expect by 2024. And there's a whole category of personal emergency response systems that are coming in today to try to support that. A third category that is also growing, it is the automotive smart car and the smart systems that are becoming part of the car. We have information on a lot of what's outside the car with the new technology radars that are available, but there isn't much information about the driver and the driver state. And having that information can change a lot of what the car would do depending on the vital signs that you can detect of the driver.
So how many companies are engaged in this space?
It varies depending on the sector you're looking at. So if you're looking at elderly care, there's almost very few companies to none that can do non-contact. Almost all of them are wearable or GPS-style monitors. So for instance, you're familiar with the First Alert, which was kind of a large, pretty much a decade or 2-decade-old industry, where you push a button and you get a GPS signal that can go out. The person has to wear the wearable, and I've worked with some elderly, including my mother, and she refuses to put a wearable on. So these are some of the limitations of that. In the case of baby care, there's about 5 or 6 companies in the U.S. There's a dozen more worldwide. But most of them are contact-based, and there's a few with contact-less coming up. They use basic motion detectors to be able to detect respiration. And most of them are respiratory only, providing not a whole lot of cardiac detection. In the automotive segment, you see about most of the automotive manufacturers, which range anywhere from 5 to 10 in the U.S., are also looking at these kinds of solutions to be able to track the driver.
Great. So you've worked in this space for a while. What are the challenges that people face when they develop solutions in this area?
That's a great question. I mean, it's exciting to be able to build a contactless sensor where the subject wears absolutely nothing and you have to detect his heart rate and respiratory from a distance. However, that technology comes with a huge number of problems. So having a very robust technology that can detect cardiac signals with various environmental and personnel differences is really the key, because the environment around it is changing so much. You're sensing somebody in a crib which is relatively quiet, or in a noisy environment, depending where that is, in a car. All these things play a role in how that detection occurs. So robust technology is key. Some of the other challenges that occur in the space is the noise that is added by various other manufacturers with unfounded claims. So having efficacy and validation is really very key in terms of making sure that you have a product that works. So there's a lot of these technologies that have been there in the last decade, but taking an innovative technology from a lab to a commercial structure really requires a lot of work and has to be scalable to a price point that meets the market need. A lot of these technologies work, but are not cost effective to do that. So solving some of those cost points is extremely critical to hit the broad-based consumer healthcare market. And solving some of the technical problems like motion impairments and other impairments that come in are critical to making sure that this technology is a viable solution.
So how does Advanced Telesensors fit into this non-contact vital sensors landscape? What position does it take?
So Advanced Telesensors is a very interesting company from its DNA and its grassroots starting point. The technology was originally developed at NASA at the Jet Propulsion Labs. Those engineers were focused on developing technologies for the Mars landing vehicles. And to do that required you to detect signals that were completely obfuscated with noise. And so those techniques had been applied to be able to build ATS, Advanced Telesensors. The ability to detect signals from noise and to do that without touching the person required detailed RF signal processing that was occurring at the hardware level and then algorithmic development at the software level. That's what differentiates ATS, and I think we are pioneers in that space right now. So this is a technology that the market has been looking for, and we've been pretty experienced in developing the technology. The team is now taking this technology and making it more of a product and commercializing it in terms of targeting key markets like babies and elders. And it has been heavily validated by our customers. So it is no longer a technology that's been in incubation. It is ripe for commercialization.
Well, that's great. So in the last few minutes that we have here, what else should we cover that we haven't?
Well, one of the things I think to bring up is the fact that this is a new category of products, vital sign monitoring. We've subjugated that as a section that says it's non-contact because we see that as being more viable in terms of where this technology can be applied. But this new category is changing the marketplace the same way we've seen prior technologies change. For instance, we had corded phones before, and then the advent of mobile phones with mobile communications allowed us to change that entire market space. We had mobile laptops with the capability of Wi-Fi that broke us away from our desks, and we didn't have a desktop PC. And now we have wired ECGs that you have to use to be able to detect your cardiac signature, which we can now do contactless with Cardio, which is ATS's product branding. So that's what's changing in this particular sector, and I think it's going to be one of the most exciting sectors to keep an eye on and watch it grow.
Well, it sounds like a great opportunity and a great product, and looking forward to seeing next steps. So how best for listeners to get back in touch with you?
Thanks, Hall, for your time. I think the easiest way to get a hold of me is you can follow me on and connect with me on LinkedIn. And it's Sajol Ghoshal at LinkedIn. That makes it easy to connect with. And we can follow up from there.
Very good. We'll put those in the show notes and hope to have you back for a follow-up soon. And thank you for your time today.
Thanks, Hall. I appreciate your time, too.
Investor Connect helps investors interested in startup funding. In this podcast series, experienced investors share their experience and advice. You can learn more at investorconnect.org. Paul T. Martin is the director of Investor Connect, which is a 501c3 nonprofit dedicated to the education of investors for early-stage funding. All opinions expressed by Hall and podcast guests are solely their own opinions and do not reflect the opinion of Investor Connect. This podcast is for informational purposes only and should not be relied upon as a basis for investment decisions.